Morning, everyone. Jason Kenney is tweeting out, I have no plans to suggest that Alberta cancel Halloween this year. My own children would never forgive me. Absolutely true. I hope that Ontario follows suit. I hope Doug Ford is listening. There's no reason to cancel Halloween. We're outside. If you can go to a grocery store and pick up groceries, you can go and grab Halloween candy that somebody's maybe dumped out of the bag into a bowl and let you grab it or whatever. Maybe use tongs if you're really uncomfortable about it. There's a way to do Halloween. Okay, the rest of this video is going to be kind of COVID-centric. The other Canadian news is Aaron O'Toole says he's going to stand up for the family and also stand up to China. And people are pointing out that it's been 555 days, I think, since the Liberals have introduced a budget, which is problematic. Could they be in contempt of Parliament if they refuse to tell us how they're spending our money? Maybe. But right now, I think the real story is in the loss of the civil liberties due to the excuse of COVID and the faulty pushing of faulty tests. And I want to examine that. I want to look at that from a bunch of different angles. We're going to look at the Prime Minister. We're going to look at what Doug Ford is doing. We're going to look at the numbers. And we're going to look at some memes and comics and other things that are appropriate. So here's the first comic that I thought was appropriate. It's a bird cage on a desk looking out a window and a bunch of birds in it. And one of the birds in the cage says, "Look at that idiot putting us all in danger." And another bird in the cage says, "Because of people like him," the bird flying out in the happy sun that they all can look at, "because of people like him or like that, we'll never be safe," right? And that's a mask comparison, right? And it's interesting these days, the what people believe, and it's a lot to do with the media, and I'm going to show you what I mean in a minute. Here's Justin Trudeau says, he tweets, "I touched base with John Tory this afternoon. With rising cases across Toronto, we spoke about contact tracing, rapid housing, and the unique challenges facing big cities right now. And I asked what more we can do to help. Together, we'll keep working to protect your health." So my concern here is cases rising he's talking about, but again, the real metrics really aren't going up that much. And contact tracing, they're pausing it in Toronto. They're getting federal, I think they're getting provincial help. Toronto Public Health is getting provincial help to restart their contact tracing. We'll get to that in a minute. But very interesting, the positioning here for the Prime Minister, ignoring the low deaths and instead reinforcing the high case idea, right? And contact tracing, we need to contact trace. Imagine trying to contact trace like a yearly flu and like preventative testing for the flu, right? Like I just don't see it. I'll say again, I've said this before, I don't feel bad sending my kids to school during flu season. Their flu kills more children than COVID-19, but I'm not worried about them dying of the flu, and I'm not worried about sending them to school if there's a flu, even in the city that I live in, right? Like even in Guelph, even if there was a flu outbreak. Now, if there was a massive flu and it was hitting every single school and only school, I might start questioning things. But if, you get posted, you get an email and it says, flu outbreak at this public school, and you think to yourself, oh, well, got to be careful, wash your hands, kind of move on, right? I don't feel worried about my kids were I to get that email. Yet, I shared a notification, a similar email, a PDF of one of the schools around me having a positive test of COVID-19, and that got retweeted a bunch because people are concerned about that, right? But again, flu kills a lot more children, and I haven't thought about it once. Okay, here's CTV News, and they're reporting rules change every day, confusion over Ontario's social gathering limits during COVID-19 pandemic. This has been mismanaged at every step. While they're telling us we're worried about your safety, we're doing everything for you, we want to keep you safe, sometimes freedom and being in a society where you get to make a choice isn't safe. Going to Taco Bell and ordering the 10 tacos and 2 large fries and 3 drinks all for yourself every day for a month, that is dangerous. You're gonna limit your life capacity, right? You're gonna limit your lifespan if you do that. But there's no laws against it, right? Nobody's gonna say, listen, you are gonna impact the healthcare system in a negative way. You can't keep coming back here. That's not gonna happen. You have a right to make those bad choices if you want to make those bad choices. And the government shouldn't be stepping in to stop that, right? Like, you can encourage people, but the rules that they're coming in with are draconian and impossible to enforce. And they're contradictory and confusing, especially when you listen to different levels of the government. Okay, here we go. The rules for social gatherings and outings is becoming confusing for many Ottawa residents during the COVID-19 pandemic. The Ontario government is constantly adjusting what you should and shouldn't be doing, and people just can't keep up. Infection control epidemiologist Colin Furness agrees, quote, I don't think anyone now can remember what is the appropriate size of a gathering. I think it's 10, Colin. Top of my head, man. I just saw it this morning. Anyway, as the pandemic continues to evolve, information shared with the public is changing too. According to Furness, it's conflicting directions from all three levels of government, and that's hampering the fight against COVID-19. Actually, I think there's a whole lot of other things that are hampering the fight against COVID-19, but conflicting and having the governments working against each other doesn't help. Back to this quote, you can be in a store with dozens and dozens of people, and that's okay, says Furness, but if you know their name, that's a gathering, and a limit applies. On Friday, the Ford government announced a pause on the concept of social circles, now asking Ontarians to limit close contacts to just those living within your household. However, it's unclear if that rule applies to public spaces, sparking instant confusion online. On Facebook, Leslie McDougall writes, quote, hard to keep up with all the rules when they literally change every day. I'm all for flying by the seat of your pants, but this is ridiculous. Caroline Briesbos says the restrictions do not make sense. No family Thanksgivings, but we can put 20 to 30 kids in a classroom, 70 kids on a bus. We can go to bars and restaurants. No wonder people are fed up. You can be in a restaurant as long as it's nominally 6 people to a table, or a bar with a couple dozen of your best friends, says Furness. No one's wearing a mask. Everyone's hugging and singing and shouting. I mean, I guess so, in a bar. Yeah. And you can do that, and we say that's okay, but you can't do it in your living room. The reality, of course, is that it's not okay at all. Furness says that it comes down to a few simple rules that everyone can follow. Here's the draconian turn, everyone. Quote, do not be in a room with anyone else without a mask unless you live with them. That's it. Don't go into restaurants. Don't go to bars. Don't go to gatherings. Don't do it, says Furness. He says the Ontario government needs to be more clear when it comes to informing the public. We need to establish what is a rule and call it a rule, not a suggestion, so things aren't optional. I would like to compel you to wear this medical device and you don't have a choice, says Furness. That's me. That's not actually Furness. But that's paraphrasing what he's saying here. We should establish a rule and call it a rule, not a suggestion, so things aren't optional. We have rules in Canada, basic rules, and things that you can't demand just because you want to keep other people safe. You can't demand private information just because you think it'll keep other people safe. And so there are exemptions to these mandatory mask orders that you can access without explaining to anybody why you're doing it. And it's funny to me that now learned people are getting their opinions printed in newspapers saying that, yes, we should be cracking down on this. It should be a rule. These people should not have any say in their own medical, using that medical device. They don't get a say in using a mask. They have to use a mask because of my preference. Yeah, sure. Get bent. Okay, Ottawa, back to this. Ottawa Public Health adds that any child who passes the new screening criteria will be allowed to return to school regardless of when they originally got sick. So they're changing things in the education. Some symptoms got taken off the daily assessment tool and blah 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 blah. And so realistically, kids will be maybe assessed as potentially sick with something other than COVID, stay home a day, and then be sent back to school sick, but getting better, and not with COVID, right? So, but no testing, right? And they don't need a test to return to school. It's interesting. And like, is this mishandling it? Is it respecting your privacy? And here's something about the masks. We're going to get into masks, but masks and the contact tracing and all of this stuff, I haven't seen any scientific data that isn't correlation study related that shows that masks work. All of the scientific, the peer-reviewed controlled studies, control group studies, basically said that cloth masks had healthy people more sick. Basically, that's what they said. And you can look at that study on CanadaPoly.com at the top, or CanadaReport.co at the top. The dangers of masks. I've got it all collected there. But here's the Ontario website that says, yeah, Ontario, face coverings and face masks. And it says face coverings will not protect you from getting COVID-19. So, I mean, like their own data, like it's contradictory, right? It's contradictory. Here's a quick one on face masks. This is a doctor using a vape. And this is, so a virus is at least as small as the aerosolized vapor coming out of this mask, right? The doctor puts the mask on and he inhales from the vape and then he exhales. Watch.
So without further ado, let's cut to the chase and take a look at an ordinary surgical mask, and I'm using a vape. As you can see, that vape, which has aerosols the same size as COVID-19 or larger goes through and around a surgical mask.
You don't need to be a doctor to understand that. Like you really just don't need to be a doctor to understand this. You can see it with your own eyes. Don't believe your lying eyes, right? It's right there. You can see it and make up your own mind. Do you think that if somebody is sick with a virus that is the same size as the aerosolized vape exhalation coming out of the mask there that you can clearly see, do you think that the mask is protecting you or them? Ants walking through a chain link fence. It is incredibly crazy what people believe currently. Here's some pertinent questions for our leadership about the testing and about what is being tested specifically. This is an email. It says, tests used in Victoria for COVID-19. Hello, Chief Health Officer Dr. Brett Sutton. Can you please assist with answers to the following questions? What are the tests that are used in Victoria for detection of so-called COVID-19? That's a PCR test. Are these tests capable of determining that there is an active viral infection in a human? Has there been an attempt to grow live samples of virus from a proportion of samples collected in Victoria? If so, what proportion could be successfully grown? Has there been a comparison of samples of live virus in Victoria with benchmark gold standard reference to the virus identified in China in late 2019? If so, what is the gold standard reference? And what proportion of tests done in Victoria were found to match this reference? So is this COVID-19 that came out of China? Can we prove it? Where can we see that data? Where can we see that? And these are good questions. And I don't believe that he's got an answer to these questions. But it's a very interesting situation to be in, because the world is using these flawed PCR tests. Here's the New York Times. And their conclusion here is that we need more rapid testing. And I don't know that more rapid testing is really the way to go. This is New York Times. Your coronavirus test is positive. Maybe it shouldn't be. Some of the nation's leading public health experts are raising a new concern in the endless debate over coronavirus testing. In the United States, the standard tests are diagnosing huge numbers of people who may be carrying relatively insignificant amounts of the virus. Most of these people are not likely to be contagious, and identifying them may contribute to bottlenecks that prevent those who are contagious from being found in time. But researchers say the solution is not to test less or to skip testing people without symptoms, as recently suggested by the Center for Disease Control and Prevention. Instead, new data underscores the need for more widespread use of rapid tests, even if they're less sensitive. The decision not to test asymptomatic people is just really backwards, said Dr. Michael Mina, an epidemiologist at the Harvard T.H. Chan School of Public Health, referring to the CDC recommendation. In fact, we should be ramping up testing of all different people, he said, but we have to do it through whole different mechanisms. Let's just have a whole new test. Let's just test a whole bunch of people in a whole different way. Here's back to this. The most widely used diagnostic test for the new coronavirus is called a PCR test. Provides a simple yes-no answer to the question of whether a patient is infected, but similar PCR tests for other viruses do offer some sense of how contagious an infected patient may be. The results may include a rough estimate of the amount of virus in a patient's body. Here's where they start talking about cycle counts. We're cycling up to 35 to 45, and above 25 is a higher instances of false positives, up to 90%. So, and the higher you go, the more likely it's a false positive. You're amplifying it, right? You're making it bigger, right? And the more bigger you make it, not the less was there in the first place, but you're just amplifying it to that degree, right? So here's the New York Times just talking about that. One solution would be to adjust the cycle threshold used now to decide that a patient is infected. Most tests set the limit at 40, a few at 37. This means that you are positive for the coronavirus if the test process required up to 40 cycles or 37 to detect the virus. So if after 24 there's nothing, and they go up to 37 and there's nothing, and they go up to 40 and there is, you've got a positive test, right? Okay, see how that works? So here's Kulvinder Kaur, I think that's how you say that. She says, never-ending loop of societal harm, elevated PCR cycle thresholds, false positive case-demic, irrational fear, catastrophic lockdowns and restrictions, more flawed PCR tests. We've got people calling for more tests. Apologies. Pierre Polyev calling for more tests. Hold on. Pierre Polyev asking for more testing. Great chat with Justin and the whole team from Royal Oaks Pub, Sittsville, regarding the impact of COVID. We need to increase our testing and get our economy back on track. Why do we need to increase our testing? I don't understand, and I would love for somebody to explain to me. You can explain condescendingly as well if you like. Feel free in the comments. What is the benefit of the test? They can't do anything. In Canada, they're not going to prescribe you zinc or HCQ. For a virus, really, they can't do anything anyway. They're not going to give you antibiotics. Antibiotics are for biological, like, what are they called? Hold on. Bacteria. And like viruses and bacteria are different. And so they create the way they get you sick is different. And I'm not a doctor. Please look into all of this. But antibacterial, right? Antibiotics don't work on viruses. So a doctor's not going to prescribe something for you. They may prescribe an antiviral, but there's nothing, as far as I know. And maybe in Canada they're supplying HCQ and zinc, but I haven't heard about that. Some places, New Brunswick, I've heard about that. But what is the benefit of the testing? I don't understand. I don't understand the rationale behind it. And the contact tracing, what are we going to do? Like, they're going to prevent those people from going out, and then what? Right? Like, when other people show up sick and you can't figure it out, what's the benefit of this? Right? What's the percentage of people who are just showing up sick without any contact with other people? Could that just be it's endemic? It's in the society? Hold on. All right. Sorry about that. I got interrupted. But I still don't understand why we are focusing on contact tracing and increasing the testing. Contact tracing in a minute. Increasing the testing in order to fight this. What does that accomplish? Here is a doctor. She's a U.S. Army surgeon. She explains why masks do not work. There's 2 minutes of very interesting stuff to watch here, but here's just a very brief clip.
That people that are now purporting to scientifically prove masks work are either being paid or being played. This just doesn't work this way. And, the outcome of this is not going to be good. The previous speaker said some of the things I wanted to say about children. Children actually, we have bad things happening here because children learn by looking at facial expressions. They socialize. We are creating a generation of people that will be afraid of normal existence, and that's not a good thing.
It is not a good thing. It's not a good thing. And just allowing these people to unilaterally make up rules based on their own whims is just wrong. Here's Patty Haydu. She says, Canada's vaccine task force is supporting effective research and development and helping us make strong evidence-based decisions on vaccine procurement and distribution. I meet with them regularly for updates on our progress on safe and effective COVID-19 vaccines. These are the last people I would trust to come up with this. They haven't followed any of the data up to now, and they're ignoring the data more than anything up to now. Back to testing, and we'll get to the data in a minute, so perhaps that should have been further down. Ontario sending staff to help support Toronto Public Health after unit suspends individual contact tracing. The province says they will be providing about 200 additional staff to Toronto Public Health after the health unit said it's scaling back its contact tracing efforts due to the rapid rise of COVID-19 cases. In an email to CP24 on Sunday night, the Premier's office said extra staff will be deployed to Toronto Public Health in the next 4 weeks, beginning with onboarding Monday. These staff will immediately help Toronto Public Health reach out to cases and also provide contact tracing support in the coming weeks, a spokesperson from the Ministry of Health said. Due to soaring infection rates and infections in Toronto, Toronto Public Health halted contact tracing of close contacts of confirmed cases outside of outbreaks in congregated settings like schools, long-term care, homes, and hospitals. Toronto Public Health said on Saturday that those diagnosed with COVID-19 will now be responsible for retracing their steps and for calling their close contacts themselves. The city's public health unit has approximately 700 people dedicated to contact tracing, the largest in the country. I'm pointing this out because it's unmanageable. You cannot just keep doing this. I scroll down a little bit. Davila, who also called the province to ban indoor dining for a month and suspend indoor sports activities and fitness classes. She also urged residents to only leave home for essential trips. Toronto reported 235 new cases on Saturday, including 10 which were added due to a data cleaning initiative. Meanwhile, Ottawa Public Health will also get additional help in the upcoming weeks with 150 more staff. On Friday, Ottawa's medical officer of health said the healthcare system is in crisis due to COVID-19. The system is nearly broken. The volume of people seeking testing is putting a strain on every part of the detection and contact tracing process, said Dr. Vera Etches. A significant backlog of unprocessed PCR test specimens, which reached 79,000 on Sunday, has slowed the turnaround time for most people seeking a COVID-19 test, with some now waiting a week or more for test results. Contact tracing of those found to be infected can only begin once a positive diagnosis is made, meaning the testing backlog delays the process even further. The Premier's office said a minimum of 600 600 case managers and contact tracers will be supplemented to local police health units, public health units, not police health units, excuse me, in the next 5 weeks. Wild, right? Like, please welcome the public health inspector. They're here to make sure you're complying with the COVID restrictions, right? Please don't complain. Here's the new saliva tests for COVID-19 are slowly being rolled out. And the medical officer of health explains their effectiveness and who they're primarily meant for. And they're warning against false negatives here because they're not cycling up. Maybe. I don't know if these are even PCR tests. The information on it is flimsy.
Nasopharyngeal swab is still what we consider our gold standard. It's still, if you have that swab, you're more likely to detect COVID more often. Sometimes if you do a saliva test, it might be falsely negative. But again, we have to balance, the reasons for getting the test, the ease of getting the test taken, and then the results or the test characteristics.
I still don't understand the benefit of getting a test. Congratulations! You've got 14 days of self-isolation. There you go. And probably nothing else is going to happen to you. This is a compilation of doctors talking about cases versus infection and the flaws in the PCR testing method. There's a whole bunch of them. There's 2.5 minutes of like the specific meaty part. Each one of these doctors has had probably, long lectures about why they believe what they believe. Here's the meaty parts condensed into a 2-minute video. This is somebody talking about Doug Ford. She says, Ford Nation has failed Ontario. His lockdown has destroyed people's jobs and businesses and has dangerously delayed healthcare for thousands of people. Let's tell Ford how it affected you and your family. Please retweet with Ford failed the people and tell your story. This one I thought was interesting. My mom has been waiting 14 weeks, 3 days for chest CT scans for lung cancer, 6 requisitions, 2 calls to radiologists, no results. She should have had biopsy, chemo by now. Lung cancer doesn't stop for COVID. People are dying waiting for medical care. So yeah, there's real impact, and it's still happening. Like, this is 19 hours ago. It's not just in long-term care. It's not just putting a mask on and people complaining about that. The long-term care was an absolute misery, though, a nightmare. Here's Carolyn Snow, who lived at long-term care facility in Keswick, said the isolation felt like living behind bars, except that the prisoners are treated better. I touched on this yesterday. I'll read a little bit of it today as well because I think it's important. The quote is, I don't want to go through this ever in my life again, long-term care residents tell Inquiry. One by one, residents of Ontario's long-term care homes described the emotional devastation caused by the COVID-19 lockdown to an independent inquiry and implored the governments to address isolation before the second wave of COVID-19 crashes down. Lonely, depressed, muzzled, and trapped are some of the words the residents used to describe the pandemic to the Long-Term Care Commission by video conference. I scroll down. Quote, we are isolated, alone, without family or friends to visit us, he said. I don't want to go through this ever in my life again. And I pray and hope that, by gosh, if there's another wave, let's deal with it adequately, appropriately, efficiently, and directly. The province eased visitation restrictions several months into the pandemic, but many homes continued with the lockdown, the inquiry heard. The province recently announced new restrictions on homes in COVID-19 hotspots, limiting visitors to staff, essential visitors, and caregivers. Carolyn Snow, who lives at a long-term care facility in Keswick, Ontario, said the isolation felt like living behind bars, except the prisoners are treated better, said Snow. She said her sister-in-law, who was staying at another long-term care home, contracted the coronavirus and died. It went from being not too concerned to being devastated, Snow said. The residents also described a litany of problems inside the homes. Residents could not socialize with their friends, ate soggy meals alone in their rooms, and watched endless television, said Sharon Cook, the president of the Ontario Association of Residents' Councils, who lives at a facility in Newmarket, Ontario. She said the lack of activity and stimulation left residents dormant and sleeping all the time. Several residents said they were left in the dark with minimal information or communication from their homes. Just to be left in a room and not know what is past the walls has caused a lot of emotional concern, Cook said. The communication vacuum left vulnerable residents confused and disoriented. And all of this there's 78 people in the hospital in Toronto. Yesterday I said I was going to look. I thought there was under 150. I heard on the radio it was 170 in the hospital, but I couldn't find that number. So there's 78 in hospital in Toronto. According to this one, there's 5,205 cases that have been hospitalized. I don't know if the 9.8% is capacity, if we're at 9.8% of capacity, or if that's 9.8% of the cases, probably 9.8% of the cases, a change of 45. So it doesn't give me the number, and maybe I'm missing it. Maybe I'm an idiot. I don't know. and but the severity, right? So the hospitalizations across the province aren't very well mapped here and on the data that I could find. So I apologize if that's not the case. Here's the Public Health Ontario hospitalizations Ontario. You can't see by date. You can just have by count. So it's by age, right? So like over 90 is that many people, 80 to 89. But this is through the whole thing. There's no way to graph the hospitalizations as far as I can tell. The deaths are here. This is up till September 5th, I suppose, or excuse me, October, I don't know if it's October 5th. This has got up to October 1st or 2nd, I think is when this data ends because of the weekend backlog and the backlog in testing. So this is going to be interesting, but I don't know that these numbers qualify for all of the rhetoric we're hearing, right? News Talk 1130 says Canada's chief public health officer says the country is running out of time to prevent a large resurgence of COVID-19. Based on what? This is October 3rd. Today's October 5th. Based on what? Based on what? Based on faulty data and lies, I think. Global News is saying, we are right back at the place where we desperately need Canadians to dig in, Canada's employment minister says. They're lying. They're lying, and I don't believe them. I don't believe them. They have zero credibility. They're not backing up anything they say with anything. Their rules are arbitrary and stupid. Wear a mask while you walk into the restaurant, while you're sitting at your table unless you're eating. How does that help? How does that help at all? The masks don't help. Honestly, bullshit. It's garbage. I don't believe them. I don't believe them, and I hope they get held accountable. Here is a 49-minute speech by a lawyer who is bringing, one of the team who's bringing this up to litigate against the COVID. Well, I'll let him describe it.
This corona crisis, according to all we know today, must be renamed a corona scandal, and those responsible for it must be criminally prosecuted and sued for civil damages. On a political level, everything must be done to make sure that no one will ever again be in a position of such power as to be able to defraud humanity or to attempt to manipulate us with their corrupt agendas.
I still don't understand how the people like Ford or the mayors of cities or even city councils are escaping the ire of the citizenry when they're saying, oh, we're just listening to the public health official. The public health official is not an elected position. The public health official can't be held accountable by the voters, but you, the people who are making these decisions, can and should be. So they're the ones who these decisions shoulders should rest on. The public health shouldn't have carte blanche to implement lockdowns or anything to that effect at all. And maybe at a certain point, if all of your neighbors are putting up white sheets to indicate dead bodies and help is needed, then we've got a problem. Then we're in a situation, and really at the beginning of this, you had to respond to what the videos that were coming out of China. And now we've found out that the money and the surveillance of that stuff that we used to pay for, that used to be world class, was mothballed in 2019 to look at vaping. Now that we know that, these people should be held accountable for that, right? And Patty Haydu and Tam and all of these people who silenced the people whose job it was to watch for this stuff, they should be held accountable. So there are people who are taking this COVID hoax, this COVID scandal seriously, and they're litigating it. But I sent this to Rocco Galati, and other people did too. And he said, hey, can we do this? He says, next to impossible in Canada, unless you can bring a successful constitutional challenge to the criminal code provision that requires personal consent of Canada's Attorney General before prosecuting for crimes against humanity. Yahtzee, right? Like, they've got the bases covered. They know what they can do, what they can get away with, and the public is giving their consent through signaling their compliance through wearing masks, that they're ready for another lockdown. They'll do it. They'll do it if they say jump. Darn the evidence. It doesn't matter how many people are in hospital, right? There's the cumulative number, don't you know, right? And it doesn't matter how many people are dying, right? It doesn't matter. They're just wanting to feel safe, and they want you to suffer for them to feel safe. And that's enough. That's enough for our current leadership, because they don't want to take a risk, right? And somebody said, yeah, they might get sued. And I think that they're going to get sued anyway. I think that continuing on with a lockdown without any kind of data to back it up, saying that we're in this second wave. Can you see a second wave? Can you see a second wave? They're trying to make one here with all the data cleaning entry points and all sorts of other stuff, but it's garbage. It's bullshit. And I mean, I'm done being nice about it. Like, I'm done being nice. You need to look at this. The people who are in charge need to look at this and respond to this. This is the most important data, the most important information, and it's being ignored in favor of over-reporting cases, right? Oh my goodness, cases, right? But people aren't dying of this anymore. They were in the beginning, and it would be folly to ignore that stuff. But you don't need to respond with a giant lockdown, and we didn't need to then either. And it's the fault of the government for not having that information, because they made the choice to mothball the information, the agency that would have provided that information. These people, the leadership of Canada, did a piss poor job at handling this crisis. Piss poor, and they need to be held accountable by the voters, or somehow. I don't know what mechanisms we have in Canada to hold them accountable, because currently it looks like the population is believing that these leaders have done a good job, but they have not. They have not. So I don't know if this is helpful. I know I'm a little tighter. I'm usually telling a better story. The data was a little bit rocky today, so I apologize for that. But there were elements of each story that kind of bled into each other, the previous one and the next one, that I wanted to highlight. So I hope that came through. Thanks for watching, everybody. This stuff really concerns me. I think that this is really a more insidious attack that most people are missing and even playing along with. And not playing along with because they want to, but playing along with because if they don't, they're going to have well-meaning Karens letting them know that, oh, you've got to wear your mask in here, man. I got told that the other day. I said, oh, I'm exempt, man. Sorry. Oh, fear eyes, right? And that's what I'm talking about. They're doing a good job with the propaganda, and the propaganda propagating this case-demic. They're doing a good job scaring people into compliance. But I think people are getting close to being done with this. I think that people are saying, put up or shut up. You need to show us that this is actually a thing. And I think that they're trying with their case numbers, right? The last couple of days, but it's not. Before I said, I hope they don't get that number that convinces the public that Ford was right and we need to lock down and blah, 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 blah. That's what they were trying to get, I think, with the 2 days of over 70 deaths, right? I don't think that they can keep data cleaning and keep that up. And I don't think this thing is deadly enough to increase the deaths by that much at all. I really don't. Even if it ripped through another old age home or two, I think that there are people on the ground there who would follow protocols, because yeah, we should protect our elderly from illness, be that flu or COVID-19 or whatever it is, right? But we don't need to lock down and destroy our economy for this. We don't. Look at the numbers. We don't. We just don't. Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co, and have a wonderful, wonderful day.